All right, we're going to get started. Let's see, where am I? Get my windows all lined up here. So many windows. There I am. Hey, how you doing, everybody? Hello, welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, and I partner with them to bring you an easy and educational workday session. Um, I'm a doctor of physical therapy and owner of PAR5 Physical Therapy here in Randolph, New Jersey. And today's session is going to be strengthening your core for better posture and pain relief. Okay, so we're going to learn how a weak core can lead to poor posture and chronic pain in the back and the neck. And we're going to learn simple functional core exercises to enhance your stability, alignment, and overall movement. All right, so let's take a look here at my slides. Without further ado, pop it on over here. Here we go. All right, strengthening your core, right, for better posture and pain relief. Now, because I am a medical professional, I have to put up my next slide. All right, let me admit the waiting room. Cool. All right. So if you're dealing with something specific, the stuff that we're going to be talking about today is aimed at a broad population. So if you're dealing with something specific, make sure that you have a thorough physical exam by a medical professional so you can kind of unwrap all the associative factors, all the things that are connected to where you're having issues. Because if you've been to any of my classes before, this video should look familiar. It's basically explaining how the body functions. The body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So what we're looking at today is the core. And if we look at the segments here on the picture, it is the lower back. And the lower back is designed to be a stable segment. The segments above and below, the thoracic spine, the T-spine, and the hips are designed to be mobile. So if you are dealing with back pain, you want to look at how mobile or how flexible, how much range of motion you have in your hips and your thoracic spine, because that's going to determine whether or not you can successfully have a stable lower back, a stable core. And that's what we're going to be talking about today. How do we make our core stable? Okay. So, step one, make sure that this alternating pattern of stability and mobility is present in your body. And step two, this is what we're going to talk about today, how to stabilize. So I think for function, we got to understand a couple of things that, we have to have this hierarchy right here. The base is going to be just normal range of motion and joint mobility. You need to be able to have the capacity in your joints and your tissue extensibility and flexibility, that next rung, to be able to get the higher levels here, right? So strength, stability, power, and speed, and actually be able to, express that capability in our skill or some sport. All right. So the core is basically what's going on in the midsection here, the abdominals, but also the back and the hip muscles. All right. I want you to think about the core as being like a barrel. All the sides of the barrel, including the top and bottom, need to be stable. If there is a faulty wall in the barrel or a weak wall in the barrel, there's going to be some leakage. All right, so leakage of power, leakage of stability, decreased stability, and then maybe pain. All right, so diving in a little bit closer to what we're talking about here, one of the key abdominal muscles, because there's 4 different layers of abdominal muscles, is the transverse abdominis. So let me pull this up so you can kind of see all the little intricacies here. So the transverse abdominis is this muscle group that wraps around from your lower back into the front. So you can see like my cursor here. Let me get my laser pointer. Here it is. So right here, this is the transverse abdominis. This needs to wrap around, and it's like a girdle. If you've seen those back braces that are like neoprene, and you kind of wrap around with a neoprene Velcro strap, That's basically your own body's transverse abdominis. And then we have the other layers, rectus abdominis, which is up and down, and the internal and external obliques that are more diagonal. Okay, so those are the groups that we're looking at here. And we want to make sure that each of these groups is strong, especially the transverse abdominis. I know a lot of people that come in to see me that have back pain and chronic back pain issues as well. Most of them have no idea how to control this transverse abdominis, okay? And that's something separate than doing like crunches or sit-ups or something like that. Now, if you wrap around the back, we've got all these muscles in the lower back, the multifidus, all of these ones that come up. And they're basically like shingles. They come from one segment to another, maybe across about 3 or 4 segments. And they go up from the base all the way up. They're grouped together as a paraspinal muscles, the muscles around your back. And then the more superficial ones over here, you have your latissimus and your trapezius muscle, right? So those are 2 muscles that also can stabilize your back. All right, one of the key ones that I want to pay attention to and often can become really tight, or people lose flexibility in this muscle, is the hip flexor. So this picture here is from the front, all right, looking at the back, and you can see the spine down the middle, and then the pelvis, and then you have the 2 legs going down. Now, the hip flexor is a combination of the psoas and the iliacus muscle. I'm going to pull this up here. And the psoas muscle, the psoas comes from your lower back, joins up with this iliacus, and then actually inserts into the front part of your hip here, your leg bone. So that is the 2 muscles that create hip flexion. And you have this lower back muscle that comes from your lower ribs, the quadratus lumborum. It comes from your lower ribs and goes straight down to your pelvis. So that's a lower back muscle that can also get pretty tight. And there's a couple different ways that we can release that. You've probably seen a couple of my videos online on how to do that. All right. So what do we do with all this? All right. So that's our anatomy lesson really quick. The thing we want to look out for first is building awareness, or what we call motor control, of what your pelvis and your lower back is doing. All right, so we're going to go over this really quick. I'm going to pull up my 2-shot here. So if you grab a chair, if you're already sitting watching this, we want to go in what we call a slouch and an extension, or a pelvic tilt. So I'm going to get really close to the camera here. So if I put my hands on my knees, just to kind of be like a buttress, I want you to take a look at my pelvis. And let me see if I could back up or move forward so you can kind of see that. There we go. I'm going to slouch, and that basically tilts my pelvis backwards. My tailbone tucks underneath me. And then I'm going to sit up tall. And as I sit up tall, my pelvis rotates forward, and then my back arches. Okay, so I don't want this movement. A lot of times people will do this, and it's all upper body, thoracic spine, head, neck. This pelvic tilting comes from the lower half of your body. So you can see how I create this tuck and then tilt. It tilts forward, spinal extension, and then tilts backwards, spinal flexion. So being cognizant or being aware of what position is what kind of helps with posture and with the intention of how do we target these muscles. All right, so that's our pelvic tilting motion. All right, so you can see that in the slide here. As you flex and extend, as you extend, you work on your lumbar extensors. And as you flex, you tuck under, use your abdominal muscles and your hip extensors, your glute muscles. All right, now we want to look on next is, we're going to work on some core strength exercises, work on some hip mobility. What is correct posture? What does that look like? And we talked a little bit about what it was in terms of how to tilt, but is there such a thing as perfect posture? And then we're going to talk about body mechanics. All right, so let me pull up my chart here. We're going to see, all right, so put this away, and then we're going to get into it here. So this is kind of like the participation part of the class. Now, so just to review, we talked about this slouch and overcorrection, right? So if I tilt back, I use my abdominals. If I go forward, I have this extension, I use my lumbar spine. So if you're sitting, rule of thumb is this, is that for every 30 minutes, you need to get up and move, right? But let's just say you're stuck in a meeting and you can't move and your back is a little achy. At the very least, you can go through this pelvic tilting in your chair to kind of just extend and flex and extend your spine. And what that does is it kind of moves the spinal joints, and also in between you have your discs, and that compression and distraction, that movement also helps to lubricate those joints and those discs. So if you can't stand up and move around every 30 minutes, at the very least, try and do a little bit of these pelvic tilts. All right? Now, next thing to work on the abdominals is you're going to lie down on your back. Okay, so I'm going to get on the floor, and then we're going to kind of translate all of this stuff, that movement that we did in the chair on your back. All right, so this is a less than gravity or gravity minimized position here. We're going to start with your feet out in front of you or straight, toes pointed, and feet together. So my legs are straight, my toes are pointed, and we're going to take your hands, keep your hands together, and raise them over your head. Now, if I do this, I lengthen my entire body, and you should feel that your lower back is arched and off the floor. Okay, so that's analogous to the sitting extended or anterior tilted position. So what are we going to do next? We're going to activate the abdominals and try and flatten the lower back against the floor as hard as possible without moving the hands, without moving the feet. All right, so see if we can activate that. So you're going to pull in the belly button and flatten the back hard, flat against the floor, and then relax and do that one more time. So you're going to pull in the belly button, flatten the back, keeping the feet and the hands where they are. All right, then the next level, much probably a little bit easier, is to do it with your knees bent. So knees are going to be bent, feet together, knees bent, knees together, but also hands over your head. The hands over your head, again, should get your spine extended, but not as much as when our feet were straight or our legs were straight. And then from here, you're going to do the same thing. You're going to tuck in that pelvis, activate the abdominals, and then hold that position. This should be a lot easier. You should feel that tension as you flatten your back and then relax. Now, as we're doing this, we're not doing a sit-up. I don't want to lift, or I don't want to use my legs. I want to keep my legs as relaxed and my arms as relaxed as possible, and my upper body as relaxed as possible, especially for this segment here, because it's the ability to activate that transverse abdominis muscle and those deeper abdominal muscles. Because if you do sit-ups, right, and especially if you do sit-ups with your feet hooked into something, and you come up and you kind of do all these things, you're going to be using a lot of hip flexors because the feet are fixed. The hip flexors are really strong to create that closing of this angle. We want to keep the legs relaxed and feel like the deep transverse abdominis muscle, which is like right above the pelvic bone. If you can feel that kind of just tense up. And you want to also breathe while we're doing this. We don't want to suck in and use the diaphragm. The diaphragm, the top part of our barrel, should be free, and we should be able to stabilize that with a little bit of holding, but also breathe properly, create some good tension. All right, so the next phase of this exercise is once we get that back flat, and I can get that there, that's the first thing to turn on and the last thing to turn off for this next section. So what we're going to do here is going to turn on the abdominals, keep it flat, keep the keep the arms and arms straight, hands overhead, arms by your ears, and then you're going to push your back into the floor, keeping the abdominals on, and raising your head and shoulders as high as you can. If you can get your shoulder blades off the ground, that would be great. And then back down. But as you go back down, that has to stay on. Again, last one to turn off. All right, first one to turn on, last one to turn off. So if we do that again, it's abdominals, stay tight, back flat, head and shoulders up, pause 1 second, 2 seconds, and then back down. As you lower, you keep your abdominals on, and then once the hands touch the floor, then you can turn that off. All right, so that's section 2. Next one, step 3 is going to be where we're adding the legs. So you're going to push your back into the floor, raise your head and shoulders, and then straighten out one leg and point. And then hold that, lower the leg, lower the hands, and then turn off the abdominals. And we can do the same thing on the other side. Abdominals on, back flat, head and shoulders up, arms by your ears, point the other leg, keep your knees together, put that down, put the arms down, and then relax the abdominals. So that little progression should be enough to kind of turn on the abdominals and get you aware of how to get that on in the front. Now, the side muscles we can do like a plank. So the plank or side plank, you can start with your knees bent and push off your shins and bring your hips up and forward so that when you do come up, you have this straight line from knee, hip, and shoulder, right? The shoulder has to stay away from the ear. We don't want to kind of hunch in, and then keep this on. We can do that a couple times, just like what we did with the other exercise, 3 to 5 repetitions, holding for about, 5 to 10 seconds. All right, and we would repeat on the other side. Now for the back muscles, we can do a bridge, which is kind of from the same position, just lifting your hips up. We want to feel like primarily the glutes are working, not the lower back. So I always ask clients that come in to see me, if we do this little simple move where I lift my hips up, what do you feel is working? What's the effort? Where's the effort? What muscles are starting to burn? We want the glutes to fire more than the quads and the glutes to fire more than the lower back. I don't want you to feel like we're moving or contracting the lower back to move the hip. Because if you think about this movement itself, it's just lifting the hip up. I'm going from a flexed hip position to an extended hip position. The muscles that control the hip are over here. Your lower back muscles, they control your back. So if you're raising or activating or moving your hips by using your lower back muscles, that's one of the key factors that could lead to back pain. All right. So we got the front, we got the side. Now we got to talk about how do we translate this into an upright position. So we can go into sitting and kind of introduce or go back to our tilt position where we had like this extended position and this flex position, activating the abdominals and the glutes. So if I go into the opposite extended position, I activate my lower back and my hip flexors. And if I go into the posterior tilt, I got my abdominals turn on and my glutes. And what I want you to feel, again, is build that awareness of where my back is, where my pelvis is, and find your neutral. All right, once I find the middle of those 2 points, I want to create that 360 contraction using the abdominals on the side, using the deep abdominals here, and using a little bit of my back so that I don't have any one part being too active. Now, if your back feels tight, we need to turn on the abdominals a little bit. And if you feel like you're totally flexed over, we need to turn on the back a little bit. So again, it's the ability to kind of balance those forces out of the front, back, and side. And once we do that, we go into our two-handed rule, I call it, where if I have my hand here, one hand at my sternum and one hand at my belly button or pubic bone, those two hands should never come together and they should never come apart. Okay, so that's flexed and extended. All right, so now if we go into standing, we can do the same thing. So same thing, two-handed rule, no flexion, no extension, just in the middle, and then kind of create that 360 stability point. All right, and then from here, the most common thing that we go over is how to hip hinge, how to use the hips to pick things up and move through life or get up out of a chair. So we did that bridge where I talked about going from a flex hip position to an extended hip position. It's the same thing, but in standing. So I'm just going to go with my feet about hip width apart, send my hips back, keeping that two-handed rule, and then come back up, bringing my hips forward. From the side, looks like this. Feet about shoulder width apart, two-handed rule engaged, abdominals on, 360 tension. I'm going to send my hips back, and then I'm going to stand up. All right, so I'm going to do that again, a little bit closer to the camera so you can see. So I send my hips back, my spine doesn't flex. I'm coming from the hip. That movement comes from the hip, and I come back up. My hips, my glutes are engaging to get me out of that position. So from here, I want to use my hips, not my back to come up. All right, so this is how we translate the stuff that we learned on the floor into a standing position. And certainly from there, we can start to add weight, picking things up like a deadlift or some type of complex exercise. But the rule is that we have to master our own range of motion and master our body first before we start to go into more complex moves. All right. So that is our posture stuff we talked about. We talked about core stability and how to reduce or avoid pain in the back. All right. So if anybody has any questions, feel free to use the chat here. Yes. So people are asking about recordings. You could see all of these recordings and all of my other past classes in any of the Better Spaces apps or websites. All right. Also, I have a YouTube channel. If you go to par5pt.com, you could probably see that. All right. I'm going to give it a 30-second countdown, and then we could close it out today, and hopefully everyone can enjoy their Tuesday and stay warm. All righty. All right. All right, thanks for joining me today. You could look for this and many more on demand of any of my classes on any of the Better Spaces apps, like I said. And I'll be back Tuesday, February 4th, for rotator cuff rehab, keeping your shoulders strong and stable. So you can learn the role of the rotator cuff in shoulder function and how injuries occur, especially in overhead sports or just reaching overhead. You're going to learn safe strengthening and stretching techniques to improve shoulder stability and shoulder health. All right, so if you have any questions, feel free to email me at paul@par5pt.com or team@betterspaces.com. All right, thank you for coming and be well.